in their counties. We are also distributing PPE to state agencies who have close contact with folks who may be sick. We're aware that supply does not currently meet the demand and the request from our counties for PPE, but we're working with Oregon OSHA to ensure that all PPE is safe, it mitigates risk to healthcare workers, and protects our first responders the way they deserve to be protected. We are maximizing and streamlining our process around the allocation and distribution of personal protective equipment as we continue to do our best to protect Oregon from this outbreak. We've also been really humbled by the number of donations from everyday citizens, businesses, and other organizations in our communities. As of yesterday, we've received over 100,000 masks and tens of thousands of gloves, and more donations are coming in every day. It's important to understand that these donations do not account for what is known as burn rate or how quickly these supplies are being used by our frontline healthcare workers. As soon as equipment comes in, it's going out to the folks who need it to protect Oregonians. If you have something you want to donate, please use the OEM COVID-19 website, and that can walk you through the process on getting your donations into our PPE supply chain. In addition to donations, we're also working to procure additional supplies. For example, tomorrow we're expecting a delivery of 78 pallets of PPE from USAID. Our relationships with the private sector and our federal partners remain a vital link in this critical supply chain. Next, I want to address something that I think all of us have been looking at our phones and the news to look for some good news, and some of that good news is the beautiful weather that's coming into Oregon. While sunny days are in this week's weather forecast, and understandably, many of us want to be outside to take advantage of this sunny weather, it's important to recognize that we've seen enough modeling to tell us that when you stay home, you are saving the lives of people who can't. The people who provide life-saving services and serve important functions in our communities need us to stay home so that they can be out and do their jobs. I get it. It's really, really difficult to not be outside and enjoy the sun. As soon as that sun comes out for the first time for a long time in the spring, we want to be out there with it. But here are some ideas on how you can still enjoy the outdoors while also helping to flatten that curve. If you're able to maintain social distancing, enjoy the outdoors all you want, but do it close to home. Get a jump on those spring projects like gardening or mowing the lawn for the first time in months. I will probably spend this weekend cleaning my gutters. Open the doors and windows so that you can let some of that beautiful spring fresh air into your home. But we need to keep up the momentum we've built so far to flatten the curve. When enjoying this beautiful weather, please don't participate in group sports or attend large social gatherings. Don't hike on crowded trails, and don't travel too far from home. And please, above all else, if you're not feeling well, don't go outside. Of course, you can always experience outdoors as long as you can stay 6 feet apart from folks that are also out and about. I'm inviting you to share with us on our social media the creative ways you're helping to flatten the curve while maintaining physical distancing. Staying inside on a beautiful Oregon spring day is difficult, but we do it because it's the most useful thing we can do to protect our frontline responders and our healthcare workers. But we also want to protect other folks who provide critical services. These are our neighbors who are grocery store clerks, gas station attendants, farmers, food processors, childcare workers, all of these people who keep Oregon going. I was living in Lower Manhattan on September 11th. I watched the two planes hit that tower and felt incredibly helpless that I couldn't do anything to help solve that situation or make that situation even a little bit better. I'd never taken a CPR class or a first aid class in my life, so I did the one thing that I felt reasonably competent at and went to Ground Zero and helped make peanut butter and jelly sandwiches. I know folks want to be part of the solution to something that's bigger than all of us. I appreciate everyone's commitment to staying home for those who can't. That's something that every Oregonian can do. So with that, I think we can go ahead and move to questions. I want to remind folks that if you have additional information that's not able to be addressed during this briefing, you can always reach out to the state's Joint Information Center. So with that, we'll open it up to questions for the day.
If you have a question, you can raise your hand on the webinar.
Hope everybody heard that. You can raise your hand on the webinar if you would like to ask a question.
Dick Hughes, go ahead.
Hi. One of the obvious questions that everybody has is what will be the metrics for making the decision
Dick, if
on
you're talking,
when...
I don't think we can hear you. Is our volume up all the way? Okay.
Now can you hear me?
And we'll circle back to Mr. Hughes and see if somebody else has a question.
Now can you hear me?
Tony Schick, please. You have a question?
Yeah, I was wondering if you could explain for donated PPE, not every hospital is accepting that, so how do you go through approving whether that can be used or whether it's homemade? What's the process like for that?
Tony, I think we caught you a little bit late into that question. If you wouldn't mind repeating the question for us.
Yeah, for donated PPE or homemade PPE that people are donating, what's the process like for vetting that or making sure that hospitals will actually accept it, and what percent has actually been accepted for use at hospitals?
So the question is, the folks that want to donate equipment, masks, et cetera, what does that process look like, and how are we ensuring that the equipment that's being sent to hospitals can be used by the hospitals? Is that the question, basically? I'm going with yes. That's the question that I'll answer. So we've got a website that's been established through the state's Office of Emergency Management for folks who want to donate supplies. Some of the supplies that are being donated are not certified as personal protective equipment. So those supplies we're reserving for folks who may not have direct contact with patients. We're only providing personal protective equipment to hospitals and healthcare workers that meet OSHA guidelines and have been approved by OSHA for use in a healthcare setting. Anything that can be donated, we will put to use. We want to make sure that healthcare workers and the folks that are working in hospital environments having direct contact with patients are only using certified PPE.
And Dick Hughes, want to try your volume again?
Yeah, can you hear me now?
Gotcha.
I apologize for that. What are the metrics at this point on where we are? You mentioned the modeling shows we're making progress. What do the metrics say at this point as to when and how a decision can be made as far as easing restrictions or continuing restrictions?
Yeah, that's a great question. If you couldn't hear it, what are some of the metrics that we're using to determine how we can or when we can ease restrictions, and what is it that we want to be able to see? I think our approach to modeling, the way we need to communicate that and the way I hope we're communicating it, is that just one tool to sort of show us the efficacy or how effective our stay-at-home measures are being. All indications is what we've been doing is starting to work. We're seeing that. So it's important that we emphasize the continued need to stay home and save lives. This is a bit of a challenge in that we're not going to know we're out of the woods really until we're out of the woods. We don't want to do anything or lift any measures that are going to give us a false sense of security and tell us we've beaten this thing until we know that we have. Anything that we would do, I think, today or even in the coming weeks to ease some of the restrictions that have been put into place put us at greater risk for further infections and then causing those surge issues that we've been trying to prevent at our hospitals. What we do know is what we're doing is working, and that's our message to Oregonians, especially this week with warm temperatures and sunny skies. Stay home, stay inside, limit your contact, ensure physical distancing, wash your hands, only go out for essential trips to maybe the grocery store every 10 days or so if you can do that, and keep doing what we've been doing. Again, the modeling tells us what we're doing is working. We're going to need to see that sustained progress and that momentum continue for the next several weeks.
Okay, we have a question from Julia Silverman, who wrote it in. The question about testing in Oregon. Can you give us an update on efforts to scale up testing in Oregon, particularly in terms of contact testing, given that similar efforts are underway in the New York metro area?
Hi, Julia. Thanks for the question about testing. At this point, we're testing a number of folks every day. I'm going to ask you to reach back to the JIC for specific numbers on how many people are being tested. We know that the federal government is trying to push out more rapid testing capabilities to all the states. And as soon as we have that process online and available, we'll make sure we provide that at a press briefing.
Matt McDonald, do you have a question?
Hi, thanks for taking my question. I just want to know, given the restrictions on testing, does the state have an estimate of how many actual COVID-19 cases there are in the state? There's only so many tests, so we're testing such a small percentage.
Yeah, so the question is, does the state have an estimate on how many actual COVID cases they are, even though we're not able to test everybody in the state, and what those numbers might be telling us? We only know at this point what we know. I think we're relatively confident that there are many more cases than what we're able to test for. I don't know how quickly we can have an accurate picture case by case of how many cases we've got in the state. Last I checked, we've tested 22,000 people, and a little bit over 1,100 folks have tested positive. So those are fair numbers, I think, to report on. But the bottom line is, regardless of how many people we can or can't test, we need to assume that by staying home and saving lives, you're going to hear me say that over and over again, that's really what's driving our ability to make decisions. We look at testing as another tool in the toolbox, but really for us, it's continued efforts to reduce the spread because we don't have the ability to test every Oregon.
If you don't mind a quick follow-up question, do you feel like it's important for the state to be telling that story about how many more cases may exist when you go into a sunny weekend like this, so people don't get a false sense of security?
Yeah, the question is it important for us to tell the story about how many other cases may be out there and may exist that haven't been confirmed as we head into this nice weather? Yeah, that's my message today. We don't know who may have it. A lot of folks have it and are asymptomatic. That's why we need to make sure that we continue to stay home and do those things to maintain physical distance. The story is we can't know who has it until we can do much more testing, and we're a ways away from being able to do that. So in the interim, we need to keep doing what we've been doing, staying home, practicing physical distancing.
Thank you.
Yep.
Mira Powell, you have a question?
Hey, can you hear me?
Yep, we can hear you.
Can you hear me all right? Okay, great. In regards to the 78 pallets of PPE expected tomorrow, what does that specifically mean in terms of numbers of supplies?
Yeah, so the question is, with regards to the USAID shipment that's coming in tomorrow, the 78 pallets that I referenced, what does that mean to numbers? It means we're getting a whole bunch of stuff that we desperately need. This is going to be on the magnitude of tens of thousands of certified N95 masks, surgical masks, gloves, face shields, all of that stuff that's going to be pushed into our supply system and immediately sent out to counties and tribes. We've been doing sit-stat updates with PPE numbers showing what's coming in, what's going out. We're going to continue to update that information, so you'll see those numbers reflected in the daily updates.
Okay, we have some follow-up questions. Dick Hughes, go ahead.
Mr. Hughes, we lost you again.
Okay, can you hear me now?
Gotcha.
Okay, sorry about my finger work. Director Phillips, can you talk at all about the new medical advisory panel that the governor announced today and what that panel's role is and why it's needed?
Yeah, so the question is the governor's medical advisory panel that was announced today. At a high level, this is to provide really important guidance and advice and recommendations for the governor as we continue to work our way through this outbreak. For specificity or additional detail on the panel, who's on it, what their backgrounds are, I would to recommend you contact the governor's press office.
Thank you.
Okay, Tony, you had a follow-up question?
Am I on?
Yep,
Yes.
got you, Tony.
All right. So not regarding the efficacy of social distancing generally, but in Oregon, you've said that what we're doing is working, but you've also said that we can't know how many cases there are in the state. So can you explain how you're able to confidently say that what we're doing is working?
Yeah, so the question is, how do we know what we're doing is working if we can't test everybody to see how this is spreading? What we're looking at is the rise in confirmed cases. Again, people are being tested who have symptoms. As we continue to test those folks who have symptoms, who maybe are hospitalized for COVID-19 like symptoms, that's a really good bellwether for us to assess the efficacy of those protective measures that we've got in place. So as we see that number of new cases decrease each day so that we have fewer new cases being reported while our testing is still increasing, we're testing more people, that becomes a really good indicator of how effective our measures are. I think we can also look at how this has played out in other countries and how it's playing out in other states. New York is a great example maybe of a state that's obviously got a lot more people than we've got here in Oregon, but they've been able to do a commensurate amount of more testing. And what they see are a slow decline in the number of folks that are testing positive for this disease. And that's after a week or two of implementing pretty strict social distancing measures. So we're not just looking at Oregon's data, we're looking at other data from around the country and around the world. And that's helping guide our determination that what we're doing is working. The fewer people we have that are testing positive, the fewer people that are entering the healthcare system that need hospitalization, those are all indicative of a successful campaign to flatten that curve.
And the last follow-up question is from Julia Silverman. Question is, does Oregon have the capacity to follow up by contacting those who have been in close proximity with those who test positive for COVID? And if not, what planning is being done to scale up those efforts?
So the question, I think everybody heard that about contact testing, how well the state is reaching out to folks who may have been in contact with someone who's been exposed. I'm not able to provide specifics on that, but I ask you to reach out to the Joint Information Center, and they can talk a little bit more in depth about the status of contact testing and tracing.
And Jonathan, you have a question from the Portland Business Journal?
Hey, so over the weekend, Governor Brown, speaking of New York, had promised to send 140 ventilators to New York State. Does Oregon have 140 ventilators to spare at this point? Did we need those ventilators, or did we have the surplus to be able to send those out of state?
Yeah, thanks, Jonathan. The question was, does Oregon have enough ventilators to justify the decision over the weekend to send 140 ventilators that were part of the strategic national stockpile, that federal cash, over to New York State? So the short answer is yes. Right now, we have plenty of ventilators to meet the need. We've got a number of ventilators that aren't being committed right now to a patient. So we feel we have that capacity. The decision was really facilitated also, I want to note, by FEMA, the Federal Emergency Management Agency. They owned those ventilators. It was hard for us to say we had supplies sitting on a shelf here in Oregon that weren't being used, that could be put to save lives tomorrow in New York State. Did I say that was a hard decision? It wasn't a hard decision. It was an easy decision. We wanted to make sure that those ventilators were where they could do the most good immediately, and we expect to have those ventilators back. We didn't gift them to New York. We lent them to New York. They're part of that strategic national stockpile, and we expect those ventilators to come back to us. And I think everyone heard Governor Cuomo from New York say they're committed to supporting Oregon. And I think Washington has done a similar thing. If we need those materials, if we need additional ventilators, we fully expect to have the supplies that we need, whether that's the ventilators coming back from New York or other states that don't have the need for those ventilators, putting them where they can do the most good. I think we've got time for one more question. And there are no more questions, so we're going to go ahead and end for today. Again, as always, if you have specific questions that either we weren't able to answer fully today, or you need additional information, or something pops into your head that you didn't think to ask during today's webinar, please reach out to the Joint Information Center. Again, it's going to be beautiful out this week, folks. Take advantage of it in your yards, near your home, in small groups, maintaining physical distance, and do all we can to continue to stay home and save lives. Thanks, everybody.